two presentations. We will then have a Q&A session. And today, for that Q&A session, we are also going to be joined by Dr. Raji Tajuddin, and he is the head of the Division of Public Health Institutions and Research at the Africa CDC. As usual, to follow our briefings, you can do that in 3 AU languages, and those are English, French, and Portuguese. And you can also access your preferred language by clicking at the globe icon at the bottom of the Zoom screen. You can also follow us on other AU digital platforms, and those are including Facebook and YouTube, as well as the African Union live stream channel. Now, to prepare for asking your questions, please take down this number. It's +251 945 502 310. +251 945 502 310. Alternatively, you can raise your hand so that you can ask your question live, and you can also send in your question on the Q&A section of the Zoom platform. That's it for the introductions for now. Let me now bring in the director of the Africa CDC, Dr. John Pengasong. Good morning, Dr. John, and you have the floor.
Good morning, Wayne, and greetings from Addis Ababa, the headquarters of the Africa Centers for Disease Control and Prevention, commonly called Africa CDC. As usual, and as announced by Wayne, this press conference will consist of 2 parts. First will be focused on the routine epidemiological updates, and with focus on some guidelines, recent guidelines that we are issuing. And then the second part will be devoted entirely to the perception survey, which, if you all recall, I had promised that or announced earlier, a couple of months ago, that we were conducting a 15 member states large-scale survey. So to start with the epidemiological part, as of 9 a.m. East African time today, the world has recorded 72 million cases of COVID-19 infections and over 1.6 million. On the continent of Africa, we have reported a total of 2.4 million cases of COVID-19, and this accounts for 3.4% of the total cases reported globally. Of this number, that is of the 2.4 million cases reported, 2 million people have recovered fully, and this accounts for 85% of the total case reported in Africa. And unfortunately, 57,000 people have died because of these infections, and resulting in a case fatality rate of 2.4%. And our overall numbers will be 3.5% of deaths globally. 5 countries that account for close to 70% of all cases on our continent include South Africa with 36% of the cases, Morocco 17%, Egypt 5%, Ethiopia 5%, and Tunisia 5%. With respect to changes this week, we observe 116,000 new cases and 2,400 new deaths reported just this past week. And this represents a 17% increase from last week. From the time we spoke last week to today, we've observed an increase of 17.2%, and also a corresponding increase of 8.7% for deaths across the entire continent. 5 African countries that are reporting the highest number of new cases include South Africa, Morocco, Tunisia, Uganda, and Libya. If we now look at the last 4 weeks, that is the last 4 epidemiological weeks between 16th of November and December 13, We observe an average increase of 6.1% in new cases across the 5 regions. And the breakdown by regions include 28% increase in Central Africa, 0.6% increase in East Africa, a 9% decrease in North Africa, 35% increase in Southern Africa, and 27% increase in West Africa. Still, over the last 4 weeks, that is the last 4 epidemiological weeks, we have observed the following trends. In new cases, Nigeria has recorded a 48% average increase. Ethiopia continued to record a steady decrease of 4%. Egypt, a 20% average increase. The Democratic Republic of Congo, with an increase of 45%. South Africa, an increase of 37%. And Kenya, a decrease of 18%. So Kenya and Ethiopia are observing decreases. That is how and why we see the East African numbers of total number of decreases of about 0.6%. In terms of new deaths, Nigeria has recorded an average of 38% increase, 13% increase in deaths in Ethiopia, 109% increase in deaths in the DRC, 28% average increase in deaths in South Africa, and a 20% average decrease in Kenya. For more information, as always, I invite you to go to our website at africacdc.org/COVID-19 to get more information. As we battle against the second wave, we continue to increase our activities from African states. We held our 34th over the last week with over 200 participants trained. We've also supported in-country training for training of trainers on the antigen testing for over 300 laboratory scientists from Kenya, Zambia, Rwanda, and DRC, and continue to support training of trainers on biosafety, biosecurity for 84 lab scientists from Eswatini, Kenya, Zambia, and Zimbabwe. As I indicated earlier, we continue to rely on and progressively increase the ability to test using the antigen test, but it requires that we do substantive support to build the country's capacity. So that is, with respect to the total number of testing, as a continent, we have reported a cumulative number of 24 million tests conducted as of today, and that represents a 3.1% increase over the last week. And 10 countries are contributing in excess: Morocco, Ethiopia, Egypt, Kenya, Nigeria, Uganda, Rwanda, Ghana, and Cameroon. And now on to vaccines. Over this week, to be very specific, on the 14th and 15th of December, the Medical Research Council and the Africa CDC jointly hosted a very important conference with a theme focused on fair, equitable, and timely allocation of COVID-19 vaccines for Africa. Some key recommendations that emerged from the meeting include the need to strengthen partnerships with the private sector on logistics for distribution, recognizing that we are going to be carrying out a vaccination exercise that is unprecedented in the history of the continent. As I said before, the continent has never, ever vaccinated more than 100 million people in every 1 year, and we have to do more in 2021 in order to have a fighting chance to control this pandemic. And we'll come back to that later. The second recommendation that emerged from this consultation was the need to make sure that all vaccines are pre-qualified by the World Health Organization, even if donated to prevent any, in order to prevent any adverse effects from occurring. Vaccines and vaccination have become a very sensitive topic, and we need to be sure that we invest a lot of efforts and time in ensuring that these vaccines are pre-qualified before we use. So that was the second finding from the consultation of this week. I must say close to 300 people attended the consultation. The third major outcome was the need for pharmaceutical companies to consider selling the vaccines to African countries at discount rates lower than the rates for higher income countries. The fourth major recommendation, was a local manufacturing of vaccines to reduce production and retail costs. And we are advancing this agenda aggressively because we believe that it will take us several years of vaccination. That is, if we meet a target of 60% in the next 2 years, which we must strive to, we still don't know the frequency of flu vaccine that you immunize every year. And because of this, local manufacturing becomes imperative so that we can meet our goals. And lastly, as part of the major outcomes of the meeting this week, was a strategic multi-sectoral communication approach that addresses key survey and implemented in partnership with different communities. Of this conversation will be devoted entirely to the perception now issued. First of all, guidelines on how to use the antigen tests for the response, and then also working with the African Society for Laboratory Medicine, a quality assurance framework for COVID-19 antigen testing to ensure that the quality of the testing is guaranteed. We've produced training materials and started conducting training. In terms of the holiday season, as we move, as from this week, going forward, and next week till beginning of January, the continent, as many parts of the world, will be going into the holiday festivity seasons. We have developed guidelines that will be rolled out on Saturday at a ministerial meeting, where it will provide specifics on how and what to do when people are feasting. This is an unusual year for all of us, and we have to continue to sacrifice some of the customs and manners in which we celebrate the end of year festivities. And we have to keep in mind that by protecting ourselves, we are protecting our loved ones, and there are some very basic things that we need to do, and especially with the understanding that 1 in 5 transmissions occur inside the household. And we will issue those guidelines before Saturday. The second thing we are working on aggressively to roll out by Saturday are guidelines on preparedness to deliver vaccines. We all have discussed on this forum that there's need for vaccines, but there's also a need for adequate preparedness and delivery. We'll be rolling out a new set of guidelines on how to deliver vaccines by Saturday. And lastly, the perception study, which I indicated earlier, will be announced shortly. And at this point, that provides a good segue for me to return the microphone back to Wayne so that she can introduce the next section. Thank you for your attention.
Thank you very much. That was Dr. John, the director of the Africa Centers for Disease Control, giving us an overview of the situation of COVID-19 on the African continent. Now, as we said at the beginning, we have a special guest today, and that guest is Professor Heidi Larson, the director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. Professor and Dr. John have worked closely together. So I would like to ask Dr. John to come back and very briefly introduce the professor to us.
So thank you, Wayne. I will start by saying that it is truly a joy and pleasure to collaborate with the London School of Hygiene and Tropical Medicine, which is one of the powerhouses of global health across the world, and has many ongoing partnerships and programs across the continent, including at the Medical Research Council in the Gambia, Uganda, Tanzania, Kenya, across the entire continent. In our efforts and in working closely, we have an MOU with the London School, and it is under that umbrella of this, the Memorandum of Understanding, that we initiated the studies of vaccine perception over the last couple of months. Led from outside by Dr. Tajudem, who is here with me, and Professor Hedy Lawson, who is a world-recognized expert in vaccine acceptance studies and programs. Even before the COVID-19 became known in last December, Dr. Lawson, Professor Lawson and I published a paper, actually co-authored a paper in Nature, where we're discussing vaccines, how vaccines save lives, save economies, and are extremely important and fundamental for our own survival of a human species. So I think we continue to benefit from the close partnership, mentorship from the experience, the vast experience that Professor Lawson brings to bear. And we hope this is just the beginning of a very long-term partnership with the Africa Centers for Disease Control and Prevention and the London School of Hygiene and Tropical Medicine, specifically on the issues of sociocultural and behavioral aspects that relates to biomedical interventions, not just for vaccines, but subsequent drugs and other things, interventions that will emerge. So thank you so much. And I'll now invite Professor Lawson to give us a brief presentation to announce the findings, the key findings of that important survey. Professor Lawson.
Good morning, and thanks very much. It's really an honor to be here, and it's been a valuable and productive collaboration with the team here. Let's see, can you see that, the first slide?
Yes.
Okay, great. As Dr. Nkengasong introduced, this is several months back, we realized there was actually one of the very first conferences that you had convened to look at the issue of Africa COVID vaccination. In virtually every presentation, there was a point to, we need to engage our communities, we need to understand. So there was really a generalized sense that understanding the issues would be important. So we collaborated with local teams across Africa in 15 countries and with Orb International, with their network on the ground, and with Dr. Taj's team. And we looked at a number of, we looked at media habits, COVID understanding, and awareness, and also what were the levers that influence people's acceptance. As I mentioned, there were 15 countries, each had approximately 1,000 people in a nationally representative sample, meaning that it was a mix of gender, age, urban, rural, and trying to capture the breadth of sentiment. We will be coming out with a fuller report, but just in the interest of time and planning for rollout and anticipated rollout of vaccines, we thought it was important to at least release the top line findings. Overall, I think I'll jump right into the slides, but the data itself, but overall regional acceptance, predicted acceptance is reasonably high at 79–80%. Safety and misinformation were some key concerns, but let me dive right into the data in the interest of time here. 1 in 5 respondents overall said they would not take a vaccine, but the good news is that 4 in 5 said they would, and that's higher than many parts of the world right now. But if you look closer at a country level, it's highly varied. So the highest acceptance, and again, these are just the 15 countries that the study was carried out. If it seems important and we need to expand to others, we can consider that. But this was trying to get a sampling across the continent. Ethiopia was highest at 94%, and DR Congo was lowest at 59% willing to accept. To me, the no is important to look at, because this is where there is resistance that we'll need, and resistance that can be influential on other people who are uncertain. And frankly, whilst we looked at yes and no, there are a number of people who are uncertain, and that's quite reasonable in this time of uncertainty with COVID itself, but also given the newness of the vaccine. We tried to dive deeper into understanding what were the factors that would motivate people to say, yes, I will, or no, I won't. There was a reasonable amount of conspiracy theory that was driving that. About 23%, about 75% said that they had belief in conspiracy theories, and about 85% 85% agreed that vaccines were safe. But there were more, the influence of safety was bigger than the influence of conspiracy ultimately across those who were not saying that they would not take a vaccine. Safety was the overriding issue, and that was followed by misinformation. The key reasons, going down even deeper to specific comments and quotes from people, the key reasons were not trusting the COVID vaccine, and that could be related to not trusting who's providing it. We see a lot of times that it's about the underlying distrust in government, underlying distrust in business. 2, I don't believe the virus exists, and that's a kind of denialism, and that will take another kind of communication and awareness that will, I think, need to put a face to COVID. The range of ages, the range of situations where COVID is particularly spreading and has had most debilitating and fatal impacts. I don't feel I'm at risk of catching the disease. I exist, but it's not going to affect me. And that's particularly in younger groups. I believe that the vaccines could give you the disease. Now, I have to say that all of these reasons are actually not, we've seen this with Ebola, almost the same things. And so there are longer term issues that come up around vaccines, particularly brand new vaccines. And there have been communication strategies that have been somewhat effective, not for everyone, but can help with this. Some of the comments we heard in DRC, for instance, it normally takes 15 years. How can a new vaccine be manufactured in just a year? Well, that's not that's a reasonable question that people are asking. And that's a question people are asking all over the world. And I think we have to do a better job of explaining why it's taking faster. We have some fantastic new technologies. I don't believe it as I haven't seen it. We need to put a face to it. The vaccine should be tested in Europe first. Well, it's been tested by hundreds of thousands of people. We have to do better with explaining that and getting that message out. I would need to see the effect it has on people first. That's another thing we can refer to the hundreds of thousands of people around the world who have received among the various vaccine candidates already, and that's why the confidence is there to start rolling it out. Disinformation. A significant portion believe in rumors. COVID is planned by a foreign actor, and that's part of the don't trust the vaccine. And that was about 50% of those who were questioning. People in Africa are being used as guinea pigs. That's 43% believed that. And that, again, has been a recurring anxiety. We also saw that with Ebola vaccines. Only poor people chosen for vaccine trials in Africa. Again, these are recurring themes, but what's important is not to dismiss them. We need to bring evidence that shows that that's not the case. Facts don't always work when people have deeper anxieties, but we need to at least address these issues and not dismiss them as being unimportant. Vaccine trials have led to the death of several children. That's also not true, but it is a deep anxiety, and also this too needs to be addressed. And the spread of COVID-19 is linked to 5G technology. I have to say again, this is recurring. We heard 4G around the H1N1 pandemic. People were blaming 3G around SARS. So there is this, it's partly an anxiety about the technology. And that's another thing that has been recurring, and we need to re-communicate and explicitly in local terms and with local relevance. On the last slide here we have is, despite the regional differences, some of the key sources, Africa CDC, WHO, healthcare workers are always high on the trust level. But also, importantly, we've seen with other studies the real importance of community engagement and local learning. Thanks very much.
Thank you very much. That was Professor Heidi Larson, who is joining us today from the London School of Hygiene and Tropical Medicine, and she is the director of the Vaccine Confidence Project. And as she has said, she has worked very closely with the Africa CDC and specifically Dr. Raji Tajuddin, who will be joining us during our question and answer session. Okay, we have come to the point where we now take your questions so that our panelists can respond to them. Let me start by taking a question from Omar Mohammed, and Omar is with Reuters in Nairobi. And Omar says, did COVID-19 have any impact on birth rates in African countries? Dr. John.
Was that birth rates or death rates?
Birth.
We expect COVID-19 to have an impact across the board on many other diseases that we are struggling with, including immunization, including the TBs, the HIVs, and malaria programs. And of course, we also expect that it will have an impact on the hospital attendance. What is typical of pandemic is that as the pandemic drags on, you tend to see more deaths occurring because of other things that are not necessarily related to the infection, but just because the hospitals cannot attend to the other things. I know your question was on birth rates, but we don't just have data we don't yet have data on the effect on birth rates on the continent. But it's a question that we will be investigating in partnership with the Susan Fred Foundation to see the impact on maternal child health.
Thank you very much. We move on now to Coletta Wanjohi, and Coletta is with FSN. She has a two-part question. The first one, are there any direct deals already happening between Africa and the manufacturers of vaccines? That's the first one. The second one, do we still stand unsure about a timeline for when Africa might start immunizing against COVID-19. So those are two questions coming from Coletta.
Thank you, Coletta. I just want to assure everyone that on this platform that the continent is not sitting idle and not doing anything. I think I've explained, and you all have been part of this, Coletta, that the leadership, the highest leadership of the continent, including Chairperson Moussa Faki of the African Union Commission, and our rotating chair of the union, President Cyril Ramaphosa, are actively and personally engaged to the extent that President Ramaphosa has established the African Vaccine Acquisition Task Team, abbreviated AVAC or AVAC, depending on which side of the Atlantic you are. And with a mandate to go out and be aggressive and courageous in looking for supplementary doses of vaccines. And that task force has been working very actively. We have been in discussions with several manufacturers, and it's still work in progress, but very promising, and including the Johnson & Johnson, including AstraZeneca, including the Serum Institute in India. So the short answer there is yes, we are talking to, but I will not qualify it at this point as a deals. I mean, you know, it takes time for those discussions to mature and then get to where they are. But be assured that as a continent, that your leadership is taking playing a role to make sure that the continent is not left behind. You also recall that on January 24th, 25th, we had that large conference on vaccine, which was also chaired by President Cyril Ramaphosa as the chair of the union and Chairperson Moussa Faki. And we all recognize that it was critical for Africa to have a vaccine development and access strategy, which was effectively developed and submitted to the Bureau of the Head of States on August 10, which was August 20th, which was endorsed. So all of this to say that let's assure that we are working aggressively to engage with all manufacturers. I want to caution that we are very early in this whole landscape of vaccines against COVID. I mean, I'll characterize what we have seen so far as the early versions of the vaccine. And I'm sure that by the end of the month and by mid-January, other vaccines will have gone through their clinical trials, phase 3, and will continue to improve the menu of vaccines that we can shop from. So I think we just have to keep this in mind, that the 3 or so vaccines that have been announced are not the only vaccines. I mean, the clinical trials I mean, many more are going through the last phase of the trials there. So that is one. Second, timeline. There's the timelines, as you know, are dictated by us 2 things. One is the ability for the COVAX mechanism to start delivering the vaccines on the continent and their own readiness as a continent. In other words, if you take a vaccine from Pfizer, for example, that requires a cold chain of -70, and you put it in Nairobi, I mean, there's no guarantee that you'll be able to vaccinate to have many more -70 locations around. So I think we are balanced. We are working very hard, aggressively, and that's what I said earlier, that coming this week, we'll be rolling out guidelines on how to deliver these vaccines in countries together with WHO, so that we have a vaccine on the one hand and then vaccination on the other hand. We are very determined as a continent that the level of conservation, that is the -25 or -70, should not be a deterrent, that we should work and get those vaccines even at strategic locations in capital cities and create vaccination points, okay, while hoping that the next couple of weeks will see us through some new versions of vaccines that may not require that extensive cold chain there. So we continue to work hard with the understanding that we know what we know today, and what we know tomorrow might be better, and will continue to help us improve our ability to deliver the vaccines.
Thank you very much. The next question is related to the one that you've just responded to. And this one is coming from Kate Bartlett, and she's from the German press agency. But over and above wanting to know about the schedule, she also asks, when and where will the first vaccination on the continent take place?
I think that is a challenging question for now, just because each African country has been dealing directly with the COVID facilities in Geneva, run by Gavi. I just had a call this morning with Gavi to coordinate our efforts to be sure that we are perfectly aligned. So we are working very, very closely. Again, this morning at 9 a.m., we had a coordinating meeting. Once we have specifics on when the vaccines will leave the warehouses and go to the respective countries, following the principles that have been listed, like the timeliness of distribution, making sure that the vaccines arrive at almost the same time as in other countries. We'll be happy to announce that. But for now, totally transparent with you, I do not know yet when they will be putting vaccines in the arms of Africans across the continent.
Thank you for that. We move on now to a question from Sarah Jerving with Devex. And Sarah says, in terms of the figures that you gave on conspiracy, safety, and disinformation, are those percentages only from respondents that said they would not take it, or from the whole 15,000 sample size? So this would be for Prof. Heidi.
Hi, that was from the whole sample size. And I just, if it's okay, somehow the screen went black, but I had a couple more slides on safety perceptions, which I think are relevant if it's okay to share them.
Yes, I mean, we can bring them back. I think that, can you bring back the slides, please?
Yes, apologies. Some reason it went black there. Can you see the slides?
Yes, we can see them.
Okay, I'll, let's see, sorry. It's a bit, for some reason, still waking up here. Okay, now here, there we go. Just to disaggregate the safety issues by country, that was also highly varied. And we have all this country level data, which we will be preparing country level fact sheets. But the safety, there was more willingness to take the vaccine than it was really, this is just the breakdown of the safety concerns among those who had in these different countries. And this is also comparing it to effectiveness. So the other issue that people were asking was about the effectiveness. But again, it's pretty varied across country, and these are also consistent with the overall trend in willingness to take a vaccine. And this one I think is important. Has the pandemic made you more or less likely to vaccinate yourself? There has been, in the context of COVID, a surge of misinformation beyond the usual misinformation that we've seen circulating about vaccines generally. And we had hoped that COVID would mitigate concerns, but in this uncertain environment, it's increased. So we wanted to see, is this going to have any impact on vaccine confidence more broadly? It's actually increased for some, the willingness to vaccinate. So where we can, frankly, COVID is a huge opportunity to show the value of vaccines far more broadly than just health. It's had a knock-on effect on all walks of life, from the economy, from education, from social and religious life. So I think it's an opportunity to show the value of vaccines more broadly, but that perception has varied considerably across countries. So again, these are different factors that we're seeing, but overall, particularly again, it's not inconsistent with willingness to take a vaccine. For many, there's been no change to views, but we can see here that it's the darkest band in the middle here of people who say they're less likely to vaccinate after COVID. But it's not a significant proportion, but we do have to pay attention to this, because what we don't want to have happen is that sentiments around the COVID vaccine do have any impact on vaccination more broadly. In fact, we would like to think we can turn it around the other way. This I already showed anyway. Apologies, those were just 3 slides that got stuck there at the end.
Thank you, Prof. We're glad that you were able to finish that very important presentation. And now I will throw the next question to Dr. Raji. It is on the vaccine perception report. And this question is coming from Elizabeth Merab, and she is the Kenyan health journalist with the Nation Media Group. Her question shows that many Africans are receptive to the COVID vaccine, but we cannot ignore the few who are skeptical. Now, the question is, what are we doing or planning to do to increase the levels of perception? I guess she means that the positive perception of the vaccine. Dr. Raj.
All right, thank you, Madam Winnie. Thank you, Elizabeth, for that question. I think the whole essence of this survey is to inform the sort of strategy the Africa CDC will deploy as far as our delivery and uptake of the COVID-19 vaccine is concerned. And I completely agree with Elizabeth, although 4 in 5 are actually ready to take up this vaccine, but we need to work on that 1 in 5. Small but significant. So we really need to work with them. And based on the findings from this survey, we already know what are those key areas, what are those key reasons why people are a bit hesitant as far as this uptake of this vaccine is concerned. So to respond to your question directly, the findings from this survey will inform strategy, will inform the sort of public health and messaging, it will inform the sort of communication strategy that will be deployed to encourage our member states to take up this COVID-19 vaccine. Over.
Thank you very much, Dr. Taj. We have a hand up, and that is our sister Sophie Mkwena from SABC, and she would like to take her question live. Good morning, Sophie, and please go ahead with your question.
Thank you so much. I just want to ask a question to the CDC director. It's well and good to give an update in terms of where we are, but it looks like there's a challenge with COVID. We saw the report yesterday from Reuters that in a leaked memo, there are reports that there are challenges with COVID, and many people had hoped that COVID will be able to facilitate access for poorer countries, but it looks like it is difficult to pull together the resources to buy in bulk because developed nations have kind of placed orders. This issue of vaccinationalism is now a stumbling block in terms of access to poorer countries. But secondly, at the continental level, what are you doing to address the concerns of the citizens of Africa on the issue of vaccine, so that going forward, when the vaccine is finally available, which is discouraging because it looks like we will be last on the line, people are able to come forward to get the vaccine.
Dr. John, I think that's for you.
Yeah, thank you. Thank you, Sophie, for those excellent questions. Let me answer that in 2 parts, and starting with what are you doing as a continent? to make sure that our people are not left behind. And several layers of activities are going on, both at the policy level, the political level, and technical level. At the political level, as I've said, I know I'm repeating myself, that the African Union Commission and the African Union, President Ramaphosa have been extremely active and exceptionally engaged in this. I think both Chairperson Musa Faki and President Ramaphosa are really champions in the area. They have endorsed, which very specifically says we need to max up to 60% of our population. 60%. We are working aggressively to achieve those. So what are we doing specifically? One, we recognize, and I'll come back to COVAX, that there is COVAX. We always knew that there was a COVAX mechanism, and I'll come to that shortly. But we also recognize that COVAX had indicated very clearly that we will have, through that mechanism as a continent, about 20% of our vaccines doses there. And we appreciate that. But remember that our target is to get to 60% so that we can achieve herd immunity, which means that at a level that it can block community transmission going on. So from that perspective, we have been actively engaged with two sources of funding. One is our own Afro-Exim Bank based in Egypt, and President Orama, who is Benedict Orama, who is the chair of the president of that bank, has approached the board, and the board of the Afro-Exim Bank has already allowed that they can leverage up to 5 billion. And that would be if member states came together and pooled together about 2 billion from their special drawing rights from the IMF and other sources, that then the bank can leverage up to that. Because they recognize that this is both a health issue, a security issue, and an economic issue. I think that is one way of efforts that are going on that the public needs to know. The second part of that effort is the World Bank. We are perhaps in weekly conversations with the World Bank to make sure that we understand the 12 billion that they announced and how much of that is coming to the continent. We are saying that about 5 billion of that will need to come to the continent to support both the vaccine, acquisition of vaccines, and delivery. Remember that the COVAX facility doesn't take care of delivery, take care of buying the vaccines, okay? But the greatest challenge for any vaccination program is how do you deliver it to the needy in a timely fashion? And I think that those are the two mechanisms that we are working aggressively. And at the more policy level, as I indicated, President Cyril Ramaphosa put together a task team called the African Vaccine Acquisitions Team, AVATT, that is meeting almost 3 times a week to discuss manufacturers with bilaterals like the Canadians, the European Union, and others to understand how to achieve our 60% target. I really want to insist on the 60% target. So that's what we are, the two mechanisms that we are doing outside of COVAX. Now, within COVAX, as I indicated earlier, Gavi, that is the host, the secretariat of COVAX, works with individual countries. And most of our countries have engaged with COVAX directly. And we are hoping that, of course, that the donors, those who are financing the global community, will continue to put the money into COVAX so that we can achieve the 20% since that we were promised through the COVAX facility. But remember that our target is not 20%, our target is 60%. Even if COVAX was to give us all the 20% that is they promised, we will still need a shortfall of 40%. So all of this to say that the continent is really working aggressively. I think I've been in this space of public health for close to 30 years, and this is the first time that I've seen the continent at all 3 levels of political, policy, and of Dr. T.J.M. Cham, Dr. Dona Buruka, and others that are out there aggressively looking for ways to finance all of these strategies that I'm explaining to you. So that is what the continent is doing from multiple angles to make sure that we are left behind.
Thank you for that response. We move on now to Michaela Martini, and Michaela is one of our partners from Regional Migration, and she is the specialist based in Nairobi. She says, in addition to traditional priority groups such as health workers, will countries also consider new groups at risk of COVID-19, such as drivers, and goes on to say, in relation to migrants, access to vaccine, which is the Africa CDC position and advocacy role with member states? That's for you, Dr. John.
That is a very important question, and this is perhaps one of the reasons why we had the meeting just a few days ago to discuss fair allocation and timeliness of that. Who gave vaccine where and when? Those are key questions that we need to really look at very, very closely. And that is what the meeting was about a few days ago. Now, we have to look at this, step back and ask the question, what do we want to do to achieve with the goal? And again, that brings us back to the continental goal of 60%. When we establish the 60%, we recognize that it is not just about preventing healthcare workers or the elderly, which we have very few on the continent. I think, some populations, we have about only 3% of our population is over 65 years old, and in some settings, 5% or even less. So we are less really concerned with that. Those people will be vaccinated. Then the other category that you've heard mentioned is those with comorbidities. On a continent, that will become a challenge because almost half or more, or 60% of the population will not know that they have these comorbidities like hypertension, diabetes, and others. So it becomes very difficult to say, well, that is how you target it. Then, of course, we are okay with the healthcare workers there because they are the frontline workers. If you look at that in numbers, say, how many healthcare workers do we have on the continent? The statistics suggest that we have 2.3 healthcare workers per 1,000 population. So if you extrapolate that number into 1.2 billion people that we are, it tells you that we have about 2.7 million healthcare workers to be vaccinated quickly. Now, if you look at that population, I compare that with a population size of 1.2 billion is extremely insignificant. You cannot win this battle with vaccinating just that. So that brings us to the question of who else. So in the spirit of saving lives, saving economies, we have to expand our vaccination pool and look at the reservoir. I give you some statistics there. Most of the infections that are driving the second wave now in South Africa are occurring between the ages of 15 and 19 years old. These are young people who are running around, they are asymptomatic, and because they are asymptomatic, they continue to drive the transmission. So that becomes a reservoir that, they go out and they have to hustle to look for, to live on very, at times, very low wages of less than $2 a day. So you cannot stop them from hustling to leave, and they come home, they are infected, they are not sick, but they transmit the virus there. So we have to look at that and say, how do we now target these truck drivers there? How do we target in capital cities like Kinshasa, Douala, Yaoundé, those motorbikers who are transporting 2 or 3 people on a bike and they are not masking, but they are drivers of the economy. We can't neglect them. That mode of economy is informal. So from the perspective of saving economies, we have to look at those populations that are generating income and living there. If we do not target and vaccinate those aggressively, you continue to have a repeated outbreak of hotspots, and you live with this cycle of the peaks and troughs of the pandemic, which we cannot as a continent survive on that. So I think then you look at the immigrant workers as well. You have to, if they're in any country, you have to vaccinate them because those those will continue to drive the infections. Okay, and then those in conflict regions. I mean, the virus doesn't respect war or non-war areas. So in areas that there are conflicts and instability, we have to strive aggressively to make sure that the vaccine gets to those populations, because they will naturally become a reservoir of continuous transmission there. So in summary, besides those that you hear all the time, which is the frontline workers, those with underlying diseases, and the elderly there, those are the different other populations that we need to aggressively vaccinate to get to a 60% that would make us comfortable with respect to having a chance that in the next 2 or 3 years we can get the virus out of our communities.
Thank you for that. We have a question coming from the Spanish news agency, and this is Patricia from EFE, Spanish news agency, as I've said. And Patricia says, would I be correct to say that some countries in Africa are already fighting a second wave?
Oh, you're absolutely correct. Many countries in Africa are already fighting a second wave. There are 3 categories of countries in Africa. One is those that never actually went past the first wave. I mean, that they have just increased. I mean, you see the trends that they were very on an upward slope, and they continue to increase. The second category of countries are those that were very successful in bringing down the pandemic, using those aggressive measures that we all have discussed in this forum, aggressive lockdowns and others. But now we see that they are coming back aggressively. In South Africa will be a typical case, and many others. In Niger, for example, by September or so, one would have declared it over in Niger. Okay, but if you look at what has happened between September and now in Niger, their numbers have increased almost like 1,000%. Okay, that is just, I mean, what it tells you. If you look at Tunisia and Morocco, around the April-May period, we would have called them make a call that they had it completely under control. But you see where they are today, with Morocco with close to 400,000 cases there. But look at the numbers in April. You'll just be stunned and astonished how much the speed at which it is taken up. So the message here is that once you lift the measures, the public health measures, quickly and in an uncontrolled manner, the virus comes back with vengeance. I think that is there. So then the other countries, some countries like Ethiopia, I indicated, continue to see a steady decrease over the last couple of weeks. So I think those are different categories of countries that we continue to see on the continent. But as a continent, if you look at the number of new cases, daily new cases, there we are very close to where we were at the peak of the pandemic in July, August. Okay, July, August timeframe, we are recording close to 17,000, 16,000 cases, and now we are close to that number, if not at that number now. So my projection is that with the holiday season coming, we will probably exceed that number by January or February or January. Absolutely no doubt about that. But again, the leadership, political leadership, public health officials across the continent must do more to work with the communities, and by using those guidelines that we are issuing this week to continue to engage the population so that they understand that the virus transmits from one person to another. And if we do the right things that we did early on, we have a chance in fighting the second wave successfully.
Thank you for that. We have a question from one of our partner institutions, that's the IFRC. And the question is for Professor Larson, and it's coming from Nadine Mushimbele. And Nadine says, what part of the DRC was the survey conducted?
The survey was conducted, it was the nationally representative sample. So was from across the country, but based on our work along the border area in Goma up to Kivu on the Ebola vaccine trials, my guess is that that's probably where the epicenter of more of the resistance was coming from. But it is, the sampling was really across the country, and I think it would be useful to maybe look a bit more subnationally. Thank you.
All right. Thank you very much. I'll give the next question to Dr. Raji. And it's a follow-up question from Sarah Jeving with the DEVEX. She says, if the goal is 60%, is it problematic that 20% said they wouldn't take it? So this is one part of the question. The second part, is there a real need to target vaccine hesitancy if 80% of respondents said they would take it?
All right. Thank you, David, for that question. So I think one thing we need to understand is that those 20%, they may actually have influence on the remaining 80%. So one way or that we just need to make sure that we carry each and every one. And we should remember that some of these 20% that they say they will not take it, some of them are not actually anti-vaxxers. These are people that possibly need more information to actually decide whether they will take this vaccine or not. So the need to continue to engage them, very, very important. Thirdly, some of these 20% are actually like gatekeepers as far as their community is concerned. So neglecting them is not the right thing to do, rather is to engage them and carry them along. Thank you.
Dr. John, do you have a further comment on that?
No, I agree entirely with Dr. Taj. Three parties. One are those that already are with you, and so your 80% are with you. The second category are those who are on the fence. And then the other people are those that are on the other side, either call it left or right. So it is our responsibility as public health experts to look at this 20% and focus on them very aggressively and bring them, win them over. I think our job would not be done until we move the 20% over and to increase the number of people that will feel comfortable with the vaccine. And I think my read of the data is also that safety is central to this, the whole vaccine hesitancy or not. I think we have to do more to really explain what safety means and to also to begin to debunk some of the misinformation around the vaccine being unsafe and others, and how the amount of energy that we put in here will help lift up the whole vaccination programs across the developing countries. So if we do a good job at with the COVID vaccine, then I can see how other vaccination programs, which is perhaps the most important tool in public health practice, will also benefit from my efforts. So I see a silver lining with if we do a good job with the COVID vaccine messaging and engagement with the community. But the leadership, the ownership of all of this must come from the community. We do not expect people to just suddenly accept the vaccines. I expect that we'll be engaging them and using all kinds of strategies, including employing socio-behavioral scientists, anthropologists, sociologists to get into the communities and understand where the concerns are and how to improve our messaging.
Thank you. I think we'll take our last question because we have just 5 more minutes to go. And this one is coming from Omar, who's watching us on YouTube. Hello, Omar. And Omar says, can you please ask that if there are fears that Africa may not get the vaccine in 2021? And also to Dr. John, how confident are you that the continent will indeed get the vaccine in 2021?
With all the efforts that are going on that I explained earlier, when Sophie asked the question, and I believe Coletta, is to say that we are doing our best to be sure that the continent gets the vaccines in 2021. and in large amounts, because if we only get to our 60% after 3 years or 4 years, the consequences will be tremendous. I mean, just imagine what countries are going through now with the second lockdown. Schools are closing, beaches are closed in South Africa. The president of South Africa just announced a whole new series of lockdowns. For me, we cannot live like that. So I think we are taking this goal aggressively, and take it from me that we're working hard behind the scene to make sure that the continent is not left behind. But as a natural process, I cannot qualitatively begin to give you exact with specifics when you get a vaccine in the arms of Africans in a large number.
Thank you very much. We've now come to that time when we do our summaries. Let me start with Professor Heidi Larson. In 1 minute, Prof, can you just summarize your key headline points that you want the journalists who are listening in now to remember?
Overall, the confidence in the willingness to take the vaccine is high across Africa compared to other regions at 79%. There are, though, a gap that will need to be addressed, and that will need, and Dr. Nkengasong highlighted some of the critical populations in that group that will need special tailoring. Safety is the biggest anxiety and concern that needs to be addressed, but I would say what we've learned is that the more people that start to take these vaccines will build confidence among those who are hesitant, and that achieving that within 2021, as the director said, will be absolutely crucial and have a knock-on effect on vaccine confidence more broadly. Thank you.
Thank you. Dr. Taj.
Thank you, Madam Winnie. I think one key thing that came out of this survey is that we've been able to identify what are the trusted sources as far as encouraging member states to take up this vaccine. So these include WHO, Africa CDC, Gavi, and the healthcare providers. So the onus is on these different groups to come together so that collectively we are able to ensure that the uptake of this COVID-19 vaccine is far and beyond what will give us the necessary herd immunity as far as the continent is concerned. Over.
Thank you, Dr. Raji Tajuddin, the head of Division of Public Health Institutions and Research. Let me turn to Dr. John for your final comments.
Thank you, Wayne. I think let me leave you with 4 comments. First is that there should be no doubt in our minds that the second wave is here, and that the second wave is threatening to be even more aggressive than the first wave. I think that is my first message. But I believe, and strongly so, that we are better prepared today than we were 11 months ago to fight the second wave. I think this is not a fight that we cannot afford not to win. We have to win the fight against the second wave as a continent to survive. So I continue to call for greater cooperation, greater coordination, greater communication across all our member states in the same spirit that we started this fight with on the 22nd of February, when Chairperson Musa Faki summoned all the ministers of her. That is one. The second thing is that as the end of year festivities are around, let's go celebrating with a theme, a common theme that are called COVID Safe Festivity End of Year Season. COVID Safe Festivity End of Year Season, which means I'm here because my neighbor is there. So that it means I have to protect myself and protect my neighbor. And the way to do that is that we wear the mask, we distance, we celebrate even indoors with the appropriate social distancing, recognizing that statistics are showing us that 1 in 5 transmissions will occur in those kind of settings, and you would never know. My third message is that that the population should continue to count on and trust on the leadership of the continent, that we are working hard as much as possible to ensure that the continent is not left behind. But it is everyone's responsibility to prepare the continent, including the media, and especially the media, that we work with you as a conduit to the community to really, it will be a tragedy. It will be a tragedy if vaccines are finally here and then we do not deliver it on a timely fashion on the population in Africa, including those issues that have been addressed during a perception survey presentation. This is, in my the best of my knowledge, the largest COVID vaccine perception study in Africa that has ever been conducted in 15 countries with about 15,000 participants. I think that is what the CDC is there for, to generate a primary data. And I really want to congratulate Dr. Taj on the tremendous amount of work, the speed and quality of the work that he and his team did in collaboration, of course, with the London School. And my sincere thanks to the London School, collaboration and partnership with Professor Larson, as you just heard her present, and we will be analyzing the data further so that we can develop some interventions there. Preparedness, again, as we go into a slow period, the holiday festivity, the virus will not go into a festivity. And the virus will be actually profit from the fact that we might be gathering to propagate. So my appeal and strong appeal to let's use this period, this holiday period, to intensify our preparedness activities, such that if the vaccines start showing up in January or early February, the system should be there to deliver. Again, we will be issuing guidance on how to deliver these vaccines and distribute them by the end of this week. My last message is that we need to celebrate the high acceptancy or perception rate of the continent. Imagine if we had found out that only 40% of the continent was willing to accept these vaccines. It would be a tremendous. So I think at times they say that there's a saying that a broken bridge makes news, but a new bridge doesn't make news at all. I mean, this is really something that we would need to work closely with the media to amplify this positive news, that about 80%, up to 80% of the population in some settings are willing to accept the vaccine. What the 4 in 5 narrative is what it should be out there. This is very important because, as the saying goes, a positive message leads to a further positive message. So if the community is aware that they are in a minority, they have to come out and join the 4 in 5. I think that will be making a lot of progress, and that will also lead to trust in the vaccines because the survey is showing that we need to build trust around safety, and we will be doing our part as Africa CDC to improve that trust building together with WHO and other partners that were cited in the survey. So I thank you all for, as always, for coming together to share ideas, thoughts. And I must admit that nobody have all the answers to where we are heading with this pandemic. We will continue to be as truthful with you as possible with what we know, and what we don't know, we'll find out and share with you, and and learn from you all. So I thank you all for gathering here today again, as you've done in the past.
Thank you very much. That was Dr. John Nkengasong, the Director of the Africa Centers for Disease Control, the Africa CDC. And today he was joined by Professor Heidi Larson, the Director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, as well as by Dr. Rajit Tajuddin, the Head of Division of Public Health Institutions and Research at the Africa CDC. Colleagues, I want to thank you very much for joining us, for being with us this morning. Let us meet again next week at 11 a.m. East African time. Bye-bye.
Bye-bye.